Welcome to the Proactive Security Podcast with Mike Hodges and Brine Hamilton. This podcast is dedicated to discussing violence prevention in healthcare. We want to inform, equip, and empower healthcare security leaders to prevent violence before it happens. And now, here's your hosts, Mike and Brine.
Hey everybody, I'm Mike.
And I'm Brine.
And this is the Proactive Security Podcast, Episode 1.
Thanks for joining us. We appreciate you listening in. And we want to take this opportunity to introduce you to us, introduce you to the podcast, and give you an introduction of what we plan on doing on a monthly basis. Mike, I guess we'll start off by introducing ourselves. So if you want to take the first stab at it, Mike, who is Mike Hodges?
Oh man, we do not have enough podcast time to dive into the depths of who Mike Hodges is. But I will tell you professionally, Mike Hodges is the Director of Public Safety at Piedmont Athens Regional, and I've been engaged in healthcare security for 10 years. I've been in a security adjacent field for almost 20 years now, spending quite a bit of time in the United States Army before I got into healthcare security. And I have also been involved for the last year as the kind of main author and publisher of the Proactive Security blog. And a advocate for violence prevention in healthcare. And I think one of the things that is so important to me as a healthcare security leader is preventing violence in an industry where violence is really out of control. And that's one of the things that has brought me here today. Brine, why don't you introduce yourself?
All right. Well, I'm Brine Hamilton. I work with Omnigo. Prior to my position with Omnigo, I've spent the last 13 years in healthcare security. So starting off as a frontline guard, kind of working my way through the ranks, much like Mike has, worked in in-house roles, outsourced roles, management. Again, I mentioned the frontline piece to get my feet wet, and it's just been an interesting ride. In 2013, I got involved with an association called the International Association for Healthcare Security and Safety, or IAHSS for short. 3 years later, I earned my CHPA, which is the Certified Healthcare Protection Administrator designation. And I've been very involved with that association, currently serve on the board of directors, and hope to continue to do so in the future. As outside of that, I'm a husband and father of 4, and I host the Healthcare Security Cast, which is a podcast related to all things healthcare security. And that was actually how I connected with Mike. We want to bring you guys lots of value, and I think between the two of us, we'll be able to accomplish that in the coming months.
I'm really looking forward to it, Brine.
Likewise. Now, let's jump into the discussion of why we're doing this. Why are we talking about healthcare violence prevention?
Forbes magazine actually put out an article just a few months ago towards the beginning of the year where they said the headline of the article was "Healthcare Remains America's Most Dangerous Profession Due to Workplace Violence." And what got me by that headline is not just the pointing to healthcare as the most violent profession in the United States, which is where I'm located, but it remains America's most violent profession. And there's so many different stats that point to just the prevalence of violence in the healthcare profession. And what we mean by that is really just any actor or threat of violence that someone has to endure in the context of their work environment. So we're talking about frontline nurses who are providing care at the bedside. We're talking about patient care technicians, nursing aides. We're talking about secretaries at the main nursing desk. We're talking about people involved in the registration process at hospitals, or the front desk check-in folks at your local physician practice. These people on the daily basis have the opportunity to see more violence at work than most law enforcement professionals. Most nurses and patient care techs in the context of their careers see more violence or are a victim of more violence than most police officers, corrections officials, and things like that. I think when you put it in that context, when you really look at the fact that those individuals who are dedicating themselves in many ways to the care for others are experiencing that kind of level of violence, you really have to take pause and take stock of the industry that's perpetuating that. When you look at some of the stats associated with violence in healthcare, the U.S. Bureau of Labor Statistics has identified that 71% of all non-fatal occupational injuries involving intentional injury by another person occur in the healthcare industry. 71% of all those. When you're talking about things that organizations like the Bureau of Labor Statistics or OSHA, the Occupational Health and Safety Administration, those are the most severe issues that are finally reported to those entities. I mean, OSHA has identified that a nurse is 5 times more likely to be assaulted at work than any other profession. When you look at OSHA, another thing that they put out is 80% of all violence against healthcare workers is perpetrated by their patients. And so we see all of these numbers, we have this understanding of the violence in healthcare, but there's no real grasp on how to deal with it. And I think probably what is most concerning to me is not only that this violence exists, that we have these numbers to point to, that we know these stats are a part of it, but we also know, and the Center for Disease Control has put out some studies associated with this, that only about 20% of what's actually happening is ever reported. So there's still some significant cultural barriers in healthcare that have to be dealt with, because we know that despite the sheer size of the numbers we're dealing with, we're still only looking at about 20% of the actual problem.
Yeah, you're really just scratching the surface, and that's been my experience as well. I know we're using American stats, but it's pretty much the same picture in Canada. There's not a huge discrepancy when you're looking at it from a percentage basis. But yeah, one thing is just underreporting is a huge problem, especially nurses just feel like it's a part of their job in many cases. We're starting to see an increase in the reporting, but underreporting has long been an issue in our industry.
Yeah, definitely so, and I think that's a failure of the industry at large. And I do think, in some cases, one of the reasons why I'm excited about putting out the Proactive Security blog and why I started that, and why I'm very excited about us now working on this podcast, is the opportunity to advocate not only for prevention methods, but more just to advocate that we understand that problem exists, and to educate a larger audience on the depth of that problem, so that we can galvanize more action towards prevention. Because I am a firm believer that violence can be prevented, and I'm seeing that play out in multiple scenarios. So I think there's opportunity for us to really make a difference in advocacy.
No, it's very true. It's funny, but now you just reminded me when you were saying, it can be, workplace violence can be prevented. I actually just kind of had this visual of you as like Smokey the Bear saying, only you can prevent workplace violence. I don't know why, but
Don't ever shy away from cool hats. That's my motto. If it's a round brown that I can wear, I'm all about it, because cool hats are awesome.
Awesome stuff. Now, as far as obviously you threw out a lot of statistics there. What are some of the sources that you're using for those statistics, just so everybody who's tuning in with us kind of knows where we're getting our information?
Sure. So I pulled data from a lot of different places. I think one of the challenges, and this is something that we'll definitely have to tackle in future episodes when we're talking about best practices, is the disjointed nature of data collection and metrics development on violence prevention in general. So you have to really look at a lot of different disparate sources to truly understand the data associated with violence prevention, and none of it is great from an apples to apples perspective. You're always trying to look at different aspects of the same issue instead of really understanding what's a true progression. But a lot of the data that I look to comes from certainly the Bureau of Labor Statistics, which is a significant body in the United States when it comes to putting forward labor data across the board, so any kind of labor-related data. The OSHA, which I already mentioned, which is the Office of the Organization Safety and Health Administration. It's going to come to me in a minute. I remembered it. There we go. I look at different professional groups like the American Nursing Association, the American Mobile Nursing Association. There are other organizations. Certainly I mentioned the Center for Disease Control, which has a kind of a smaller segment of that organization called the National Institute of Safety and Health. Puts out a lot of research data associated with different aspects of work-related issues, and violence in healthcare being one of those. So there's lots of different places to pull from, but there is no good big picture one source point for workplace violence related data.
Right. And I know that's been a big point for our industry too, as of late, is how we're collecting data. And I know through the IHSS, we're working through the data warehouse project, which will hopefully help tackle some of these issues of just getting consistent information and being able to apply that to our security programs. I know that's a big work that's being taken on right now. Hopefully in the next few years, we're going to see some great results from that will really help us tackle some of these issues.
I think programs like that are tremendously valuable. And the one of the things that IHSS has done pretty consistently is the crime survey, which allows for a lot of reporting directly from healthcare security professionals all across the globe, really, and provides a good opportunity. But one of the things I also have noticed is the disparity between reporting from a clinical perspective and reporting from a security perspective. And so, in whatever organization you're in, you've probably got a reporting platform for workplace variances and safety issues and things like that. And then you probably also got a separate reporting system for your security program and how those officers file security incident reports. I know a challenge for us has always been the disparity between what a nurse reports on the front line as something that has happened to them versus what security officers report as they respond to different incidents or are called for assistance. There's a huge gap there that has opportunity written all over it as we try to align not only the report from the frontline victim, but also the reports from our security professionals as they respond, and try to understand the differentiation between those different points of data. And that's just another kind of microcosm that leads into data development across the entire industry.
Another thing that we want to talk about today is just the impacts of workplace violence in the healthcare environment. What are some of the things that you've seen as far as impacts? And I'm sure you'll have some more statistics for us to go through as well.
So impacts is a good word. And I think there's a couple of different things for us to talk about. So there's significant impacts on the individual employee. And there's no way we can ever minimize that, because when you talk about violence, you're talking about a human story. Violence in any context, in any form, clearly and definitely relates and impacts and damages a human's story. And oftentimes when we get deep into data, and I'm the first to do this because I am a data nerd, so I love numbers and making those work and helping utilize numbers to tell a story. But that's what you're doing. You're utilizing numbers to enrich and tell a story, which we cannot lose track of because that story happened to someone. And when we talk about however many hundreds of assaults that occur in whatever facility across whatever region, each one of those assaults, each one of those individual instances is a moment in an individual's life. And so you have to understand how this impacts the human drama as it plays out in our facilities across the globe. There are numbers to look at on the impact. When you see, again, when I look at numbers from the Bureau of Labor Statistics, when you look at the impacts of violence prevention, you see things like a 7% increase in absenteeism in significantly violent environments, like emergency departments. You see a 6% increase in turnover after a violent event. You see a 9% decrease in productivity when you see an associated increase in the fear levels of the employees working in that environment. One of the things that we've seen is if you look across days away from work as a result of intentional injury by another person, the average is 7. 7 days of lost productivity, of lost work due to the injuries that individual sustained as a result of that violent act. And that's just to speak to the direct loss of work. That has nothing to do with the trauma associated with being violently assaulted. Healthcare workers in the United States comprise 11% of all workplace injuries involving days away from work, as compared to 3% in all other industries. So it's just a significant gap in how much we're impacted by that. And it certainly impacts the human story, that individual, and the trauma that's going to be associated with them in their life for having been a victim of a violent crime. But it's also going to play out across the entirety of that unit, the people that work beside that individual, whether they were injured or part of the assault or not, they're still impacted by that trauma. And that's where you're going to see some increase in the absenteeism and turnover and those types of effects. But it's also going to impact the ability for the people in that environment to provide quality care. Because if you're scared to death that you're about to get assaulted, you're not going to be providing the kind of quality care that you need to be providing in a healthcare organization. And I think we have to, as healthcare leaders, start to connect quality care environment with safe and secure environment as well. And that's a critical component for our frontline healthcare workers.
You touched on a lot of great points there and a lot of great stats. And one thing I'll share, when I was in high school, I was actually invited to the Math Olympics. So when you talk about being a numbers nerd and a data nerd, you're speaking to a kindred spirit.
There you go.
No, and the one thing too that I'm glad you brought up was just the potential trauma and damage that these events can have on an individual. Another thing like workplace violence that's starting to get a lot of attention, and deservedly so, is the post-traumatic stress or critical incident stress, however you want to define it. That's been a huge problem, but we have a lot of people who are now kind of advocates for that, and will talk about those subjects that have in the past been difficult subjects to talk about. So, I think we're doing we're doing the right thing here by doing this work, and we're kind of we're moving in the right direction. And I'm really glad to see that at the end of the day.
I really think that's a great point. You talk about critical incident stress management. I think that'll be a great topic for as we start to hone in on some best practices and some opportunities to engage, because dealing with the trauma and the effects that ripple out from the individual injury are just as important as being able to provide care for somebody who's injured in an event that involves workplace violence. So great point.
Another thing too, I want to congratulate you on the Proactive Security blog, because you've completed a year of that now. So it's a great work, and that's really how we connected. What's the experience been like, this last year as far as, doing that work? Obviously, workplace violence in healthcare is a big topic because, you have quite the library right now of blog posts, and you're having no shortage finding material to continue with on that blog. So can you share a little bit? Well, actually, can you share about the blog first of all, for anybody who may be listening to this podcast and maybe hasn't had a chance to check out the blog yet? What's it all about? And what's been the experience like over the last year of this labor of love, this passion of yours?
Yeah, so the blog was a true accident. I'll be honest with you. I've been a part of developing a workplace violence prevention program at my own facility for several years now, and that's really what has resulted in my passion for healthcare security in general. And so, you mentioned it earlier, and I didn't dive into detail, but I started back in 2010 as a frontline night shift security officer. I was fresh out of the Army. I was trying to go to school full time. I needed a job that I could have some benefits and make a little money, but also free up my days for finishing my education, and just fell into it on accident. And I like to say that I'm accidentally interested in it. I did not expect to get interested in it, but what got me hooked into healthcare security is that prevalence of violence in the industry and the opportunities to help. And I think that's the exact same reason that I started the blog, is I've seen so much disjointed discussion and confusion around how do we handle this as an industry. There's lots of recognition out there that violence is out of control, especially amongst our peers as healthcare security professionals. There's lots of recognition out there that the violence epidemic in healthcare is out of control, but not a lot of different organizations pointing to solid solutions. And so one of the things I just wanted to do was create an environment, or create a forum where ideas can be shared. And so I just started the blog really on a whim, and it took off, and offered me the opportunity to connect with different folks like yourself in the industry that are doing awesome things, like your healthcare security cast, and really start to put information out there on things that I've seen work. And that's one of the things that I like about us putting together this podcast, is again creating an opportunity where we can put information out there that can help. Because one of the things that I see as one of the most significant issues in healthcare industry's approach to violence prevention is we forget about the word prevention, and we get too tied up in reaction. And we're really good at coming up with special codes for when people are flipping out and hurting someone. And everybody rushing and everybody helping, and those tools are needed. We need to be able to respond effectively to active violence, whatever form it takes, whether it's an individual one-on-one assault or a mass shooting in the lobby, whatever that looks like. We need to be able to respond, react, and make that event safe to the best of our abilities. But we really fail to functionally look at prevention and proactive solutions well. And the name of the blog is the Proactive Security Blog, because I'm all about that proactiveness. And we brought that into this podcast with the Proactive Security Podcast. And I'm all about trying to find ways to stem violence before it ever starts. One of the things we absolutely know in healthcare is that a large portion of our violence, and we already know 80% comes from patient to staff, a large portion of our violence is not criminal in nature. It is a part of disease progression associated with the care for a patient. And some of that is a big part of what feeds into the cultural issues associated with violence. Is we don't see violent offenders, we see patients that we need to care for. And there's nothing wrong with that. In no way, shape, or form am I interested in criminalizing every act of violence in healthcare, because I understand fundamentally that disease progression is a significant part. And we see conditions that produce altered mental status create violence all the time. But, and I cannot underscore this but enough, we still have an obligation to protect our staff. So I want to see us come up with proactive, preventative violence prevention solutions that really help us protect and prevent, and not only keep our staff safer, but also provide better care for the patient. In my first series of blogs, it was all about violence risk assessments, which is a clinical tool. There's lots of different kinds, and I'm sure we'll dive into those a lot more deeper and in greater detail in future podcasts. But these are assessment tools that are clinical in nature that help us identify precursors for violence. Not only do they help us treat the patient more effectively, because acts of violence and the precursors for violence can demonstrate clinical deterioration in the patient's disease progression, but also help us keep our people safer for the patients, safer for us, because we can assess effectively and we can come up with clinically integrated solutions to prevent acts of violence. And so, my blog really got started from that vein. I want to put information out, and I started that with the violence risk assessment series, and then have gone a lot of different directions. Sometimes it's just because I like to riff on different topics, and my wife wants me to go write about it instead of bore her with it. In either case, it's been a tremendous ride connecting with different people like you, and also sharing different ideas about healthcare security in general and violence prevention specifically.
Very cool. I had you on episode 3 of the Healthcare Security Cast.
Yeah.
And the Healthcare Security Cast, for anybody who hasn't heard it yet, is just really, it's a podcast that's focused on different topics related to the industry, and also just some personal development stuff. So I've had somebody who's a LinkedIn advisor come on to talk about networking. And Mike, I don't think I shared this story with you, but what made me reach out to you about doing a podcast together was I was actually cleaning my pool the one day, and I was listening to some old podcasts and just trying to pull clips out of it. And I was listening to ours, and it took me back to actually when we had recorded it originally. And I was thinking, this was a guy who I really enjoyed talking to. And obviously this topic that you're so passionate about, that you have so much information about, is, it is basically the topic right now in our industry that we're all trying to develop solutions for and kind of wrap our heads around. So I was thinking I need to reach out to Mike, and we need to put this in the podcast form. I remember, I actually still remember it to this day, just sitting down and sending you that first text message saying, what do you think about this? and you're receptive right away now with everything going on, you being a father of 3 and having a busy job, me being a father of 4 and having lots going on as well. It took us a while to get here, but we did. And that was kind of how we got started, and doing a lot of stuff through email and messages on LinkedIn and text messages, and finding times in, like right now we're recording this on a Sunday night because we had to get our kids in bed so we can take some time to do this. But no, that was basically I never shared that story with you, but I thought I might as well share that with you now and kind of give you that insight. But
Well, I'm glad you did. I think, I remember when you sent me that text, I was so excited about the idea that I called you back almost immediately. It's like, hey, this is a thing. Let's do this. But listening to that, I'm really glad. That was an awesome opportunity for me to be on your podcast. And I did a interview with you on my blog, and little did we know we'd be here on a Sunday evening. So many months later, putting this together. But I'm excited about the opportunity, and I think as we pull others into this process and start to get deeper into different information, I think we got an awesome opportunity to share with others in the industry and have others within the industry share with us. And I'm looking forward to it.
Awesome. So now that we've kind of told everybody what we're going to be talking about, I think we've given a good introduction to how we got here and what people can expect. So do you want to talk about what the next episode in October is going to be all about?
Yeah, absolutely. So I definitely think our next episode, we're going to focus in on that proactive versus reactive stance. And I've already alluded to that a little bit as we talk, but I want to talk more about being proactive versus being reactive, the tools associated with reactive responses to violence and the tools that can be associated with a proactive response to violence, and really trying to take initiative in the way we react as an organization and the way we respond as an organization so that we're leading in violence prevention. We're not trailing in violence prevention. And I think getting a better understanding of proactivity versus reactivity in violence prevention is going to be a really interesting conversation.
Well, awesome. As always, Mike, it's a pleasure speaking with you. Thank you, everyone, for tuning into the first episode of the Proactive Security Podcast. And until next time, stay proactive.